name is Enoch. I'm a psychiatric nurse, also my therapy center, and today we're going to learn something about sleep disorders. The first, I'm going to start by definition of sleep. What is sleep? Sleep is an altered state in which people become relatively unaware of external stimulation. And I'm going to study several disorders that affect our sleep. There's several, but I'm going to specifically study the two that are common, especially from my experience. I'll say the example of the sleep disorders. The first one is hypomnolescence. There's also narcolepsy. Then also there is insomnia. Insomnia is the very common one, and that is one I'm going to discuss with hypomnolescence. There's also breath-related sleep disorders. There is circadian rhythm, sleep-waking disorders. And then also there is also rapid eye movement related disorders. There's also restless eye syndrome, sleep disorders. Then there's also non-rapid eye movement disorders. There's also nightmare disorders. Those are the sleep disorders. If I'm not wrong, they are the all sleep disorders. So, what is the normal time rate that you have to sleep? The usual time, the ideal time of sleep, the duration. We should be sleeping the period between 7 to 8 hours there, or if they can go up to 10, but 7 to 9 hours there best. The minimum is 6 hours, but 7 hours and beyond there is well. But when they go beyond that, that is excessive sleep. But when we come below that, that is less sleep. The first condition is insomnia. Insomnia is a condition where you have the sleep duration is lower. Based on the quantity or the quality of sleep, you sleep less. Like I can sleep like 2 hours or maybe 4 hours. I can't attain the total calculation of hours. I can't reach 6 hours. Maybe I can wake up very early, or maybe I wake up at a certain episode, like in the certain intervals. After every maybe 3 hours I wake up, or after every 30 minutes I wake up, maybe due to disturbance. That is diagnosed as insomnia. So what is the causes of the insomnia? There are also it can be maybe due to psychiatric condition or psychological condition, or maybe it's a medical condition, or maybe having quarrels before going to sleep. There's also excessive alcohol consumption is also related to that. Then also heavy exercise, particularly after taking a very heavy meal and then you go to exercise, the muscles become fatigued. Note that not every exercise can cause insomnia, but there's also some healthy exercise, especially when you go to the gym, or maybe I'm going for workout for the first time and I overdo, I do excessively. So obvious, you will have muscle cramps, fatigue, and the lactic acid will release in the body. For the one who know medical, there's an acid that is released in the body. So at night you will have some sleep disturbances and rhythm, so it will cause insomnia. So the management of insomnia. So the first one, you have the good sleep. You have to take the sleep history, then investigate taking the hours, taking the total hours that the client sleep. Then also calculating them relating to the sleep quality and quantity. Then also to rule out any psychiatric disorder or psychological effects that are relating to the client, and also rule out the effects of medications that the client may be taking. Maybe they have a certain condition, like when you have a chronic condition, including cancer, undergoing chemotherapy. It is also strenuous when someone has such medication. Some of the medication that can cause insomnia, can cause less sleep. Then also you have to take the daily diary. Take the daily diary of the client, maybe taking the history, or if you have the one, you can calculate yourself, maybe after today, which is the season that I don't, it is actually used to rule out any, maybe the underlying cause, basing on the statistics and the mastering of how the client or the certain person sleeps. Also, good sleep hygiene measures. You have to take good sleep hygiene measures. Maybe if you have a quarrel with a person, or maybe the mood changes, it is also important, especially when you have quarrel with a person, or maybe common disagreement. It can lead to a train of thoughts in the brain, maybe thinking about something at night. So it reaches a time you just wake up at bed, you sit down, start thinking about it, or maybe trying to force out things. No, sleep hygiene is also important to emphasize on this. Maybe you go to bed and you have your cell phone, going to the internet, sitting there until some hours. So that also causes insomnia, because that is not a healthy way of sleeping. There is also treating the underlying cause, maybe based on the condition, maybe as the way I have emphasized stress on the psychiatric illness, or maybe psychological conditions that are affecting a person, maybe having depression. So there is also psychotherapy, it's also part of treatment. Then also psychoeducation on the importance of sleep.